I'm Dr. Stephen Lloyd. I'm a primary care physician, a medical informaticist, and, well, I actually helped build some of the very first medical databases way back in the 1970s. After a 50-year career on the front lines of medicine and technology, I've decided it's time to step forward. I'm here today to give you a whistleblower's account, an eyewitness look into exactly what's gone so terribly wrong with the American healthcare system. And you know what? It all starts with one absolutely catastrophic number.
$36 billion. Take a second to really let that sink in. That staggering, massive amount is exactly what the United States federal government spent to digitize your healthcare.
So where did all that money go? Well, it was primarily driven by something called the HITECH Act of 2009. Now, the intention behind this legislation actually sounded pretty revolutionary at the time. The goal was to heavily incentivize hospitals and independent doctors to finally adopt electronic health records, or EHRs. Sounds like a smart move, right?
But here's the hard truth, coming straight from my 5 decades of eyewitness experience in the trenches. Instead of actually improving patient care, we completely failed the system's architecture. We didn't create some brilliant cognitive tool for clinical reasoning. No, we just automated the chaos. We essentially turned the electronic health record into a massive administrative instrument, one that's optimized almost entirely for revenue extraction and billing compliance, instead of actual clinical intelligence. I want you to picture something for a second. Imagine a highly trained, totally exhausted doctor sitting alone at a glowing computer screen late at night. The sheer mental drain of clicking through these endless, clunky drop-down menus, it just strips away every last ounce of their remaining empathy. In the industry, we call this the pajama time intrusion. It's this tragic reality where relentless administrative documentation forces its way into a doctor's personal life long after the clinic doors have actually closed. Think about that. We've literally degraded some of the most highly trained professionals in the world into glorified data entry clerks. Today, doctors are spending 2 solid hours on documentation and screen time for every 1 hour they actually get to spend face-to-face with a patient. It's completely backward. We're obsessively tracking clicks instead of just looking our patients in the eye. Now, I can tell you right now, we absolutely cannot fix this crisis with more regulations, extra checklists, or, just a few incremental software tweaks. The foundational architecture itself is broken, beyond repair. We have to tear it down and replace it entirely from first principles. And that is exactly where the XHealth blueprint comes in. This is our radical architectural cure. By utilizing advanced AI to automate that data capture, we can literally remove the doctor from the data entry loop entirely. We need to stop making the physician the clerical bottleneck. It's time we return their focus and their precious time completely back to the art of healing.
Because at the end of the day, shouldn't your doctor be looking at you instead of a screen? To know more, read my full story in Chapter 2, The Analog Failure, from our book XHealth, The Operating System for American Vitality, available now on Amazon.